that somebody had written in. We talked, I believe it was last week, about being in a school setting and being in the lunchroom or being on the playground, and how sometimes it's sensory overwhelming to our kids. And you talked about that background noise, how overwhelming it. And you mentioned in passing that there are things that we can do to help our kids acclimatize to that background noise and to be able to differentiate. And they were wanting you just to expound a little bit on that because they have a child who is dealing with that, and what direction do they need to go in? What kind of help do they need to ask for?
Sure. Well, I mean, the kids all have different types of reactions to different sounds, you know, so the first thing would be very important to identify what are the things that are distracting the child or just, you know, bothering him even. Sometimes the kids are disturbed by the noises. And then what we do, it's a series of steps, essentially. And you start with just you make a list of all the different types of sounds, let's say, that are disturbing the child, and you start to acclimate the child to each one very gradually in the home setting. It's kind of a desensitization process. So, you know, the most common, of course, being just like the sounds from a classroom or playground noise, that sort of thing. And you can record the sound at school, play it in the background in the room where you're working with the child, assuming that you're doing a behavioral type of intervention with the child, and gradually get the child to learn to just respond to foreground, you know, which is language or instruction, and be able to keep that from distracting him or her. And so it's just a procedure where you go from the lowest intrusive sound, let's say, to the highest intrusive, and you go very gradually, and you allow the child to acclimate and to be able to pay attention while that sound's in the background. There are actually tests that are done just for sound discrimination as well. I mean, there are certain tests that you will, for instance, ask the child to identify certain labels, and when there's sound in the background, you notice that kids get those labels wrong just because they're not able to focus on the particular thing. So it's really important to actually identify if your child is able to listen to instruction. A lot of the kids have problems with sound. It's a very common thing.
Who would you go to have that kind of testing done? Who does
Any
that
psychologist would be able to do it. Sure. I'm sure the school would have resources as well for that. It's auditory discrimination testing. And so it is so important, though. I mean, and let's not forget to say that auditory is just one source. You know, in the school, there's also other things that could be distracting. A lot of times for the children, if they're sitting, you know, further away from the teacher, then it's very hard for them to pay attention to the teacher. So, or if they're sitting, let's say, close to a window, they might be looking outside, or those types of things. And all of that, of course, you start with what I call the most sort of laboratory type setting. So in the room, in the child's room at home where you're working with the child, you can begin to replicate as many of those conditions as you want, but one at a time, allow the child to acclimate. We even do what we call mock preschool, where we will set up a whole scenario with the child sitting on the floor, perhaps have, you know, the parents or siblings or whoever's available, so the child becomes very acclimated to the exact type of setting that they would have in their classroom.
But you kind of layer it on piece by piece. I'm envisioning lasagna. I don't know why. That kind of a morning. But, you know, layering it on one thing at a time, so you're not heaping it all on at once. It can be so overwhelming.
Right, which is why our kids have that problem in school, because in school, of course, it's everything all at once. Right?
Exactly.
And sometimes you just won't be able to tell unless you really pay attention to what's going on with the child. One of my kids had absolutely no problem in the classroom, but about 10 minutes towards the end of the classroom bell or period, he would start to get really anxious and distracted, and sometimes would even throw a tantrum. And we found out it was simply because the sound of the buzzer or the bell that would change periods in school was so disturbing to him that he would start to fear it. And you know, our kids, some of the kids have an amazing internal clock. They know when it's coming. So just paying attention and looking and seeing what is distracting the child or what's causing any kind of disturbance, and then gradually infusing it into the home setting first.
And it could, because you mentioned it could be more than auditory. I'm thinking even those, sometimes the fluorescent lights flicker.
Oh, the fluorescent lights are very disturbing to some of our kids, absolutely. We don't see the flicker. We actually, it's funny because when a fluorescent light starts to die, when the light bulb starts to flicker and we start to see it,
yes,
that's what I think a lot of our kids are experiencing just at normal when the light is working.
And it's disconcerting. It's hard to concentrate when you can see that flicker. Amazing.
Right.
I'm noticing too that the LED lights that are out right now for all the holiday lights have a flicker to them.
Yeah, that's
that
right.
can be disconcerting. Something to note.
But I mean, just one more thing on that, Shannon, is that a lot of times we try to avoid situations or stimuli in the environment that disturb our kids, and it's you have to do that in the very beginning because there's too many of these types of stimuli and they may be disturbing our kids. But what I always say is try not to avoid situations at all, no matter what the situation is, but take it, break it down, expose the child to elements of that situation and make sure that your child is able to cope and do well in any situation.
Yeah.
And that's very important, of course.
Absolutely. And if you think about it, it's just an incredibly kind way of doing things. We really could be doing that for ourselves, too, if something is overwhelming, taking it a little bit of a time at a time.
It's gradual, right.
Absolutely. Okay, and this was a question that I think we need to do a little bit of backup on it to tell you where this question is coming from. But, hi, Dr. Doreen. I'm surprised and even scared to know that the research on the amount of ABA delivered says that if ABA is done less intensively, i.e. less than 10 hours or so, the IQ of the child actually drops. How is that possible? Is it true even for quality ABA? Please share your valuable thoughts on this. Thanks a lot for your time, from a concerned parent of a 9-year-old on the spectrum. So a little bit of background, that we had somebody write in the other day a question about they need to go in and argue for they have a 3-year-old arguing the efficacy of the ABA provider for a 3-year-old recommended, I believe it was 15 hours. And they were saying, what do I need to do to go in and argue for more?
Right.
Are there studies that show? And Angela Persicki, who's a BCBA here, came in and talked about some of the studies that are out there that show that efficacy of that 30 to 40 hour window, especially with small kids. And on her graph, they were showing the difference between, and there was one point, a plot point on it in particular that showed, because it showed IQ and also mastering different elements. There was one point that was for somebody, a group of kids having 10 hours or less, where IQ had actually dropped by 10 points. And and we've had 2 people write in this week and express concern.
Sure.
And I wondered too, because I didn't take it that it was that the ABA had dropped the IQ, that IQ would have dropped anyway.
That's right.
But that we didn't have the benefits.
Let's talk about that, exactly. Yeah. So all of the studies in ABA basically point to the fact that all the studies show that the groups that received fewer hours, or fewer than, let's say, 10, average 10 hours, did not really have what we call the optimum outcome, or the best outcome. So the concept with ABA, of course, and the reason that we do it intensively, what's our goal? Our goal is to take the child's mental age, which is kind of the level of functioning that the child has, and try to expedite that so that it reaches the child's chronological age. So typically, when typically developing child, their chronological age, their normal age, is the same as their mental age. So it corresponds together, right? And IQ is the ratio of mental age to chronological age. So if my if I'm 49 and my mental age is also 49, then my IQ will be 100. It's just a ratio. It's a very easy ratio. Now, when you have a child who is, their mental age is behind, what you have to do is obviously teach them a whole ton of stuff in order for them to learn and be able to actually get better and better and better. And then the idea is, okay, we're increasing their mental age faster than their aging, than their chronological age. And so if you do that, the numerator of this formula increases faster, and so you reach higher IQ. If you don't do that, obviously with aging, because aging is happening anyway, your denominator will get bigger and bigger, right? So your age is getting higher, but your mental age is not catching up with it, so your IQ will drop.
Okay.
So when we say that, just doing 10 hours of ABA or any amount that's not enough, and we'll talk about that in a sec,
Sure.
your IQ will drop. All we're really saying is that with your aging process is going faster than your learning process.
Okay.
That's what we mean. So if you're doing 10 hours, it may not be adequate. It may not make your mental age gradually meet your chronological age. And at a certain point, like we talked about, past age 7, 8, and so on, the what we call malleability of the IQ, like the ability to learn that fast slows down anyway.
Right.
And that's why it's so imperative to be doing this type of intervention at an early age, because earlier your brain has so much plasticity that you can overcome various things that you weren't able to do before.
Right.
It'll just overcome it. So the issue is that unless you're doing as much as you can, the child will age faster than you're able to teach them.
You won't catch up.
You won't catch up. And this idea of, 10 versus 30 is very difficult to, a lot of people, I have a lot of different feelings about this idea altogether of like, should it be 10, should it be 30, should it be 40? And I really feel that it takes a level of experience and expertise to try to really be accurate about what is the optimum level of hours that I should be doing with a child. First of all, even assuming that the ABA is high quality, really the best you could be doing for the child at all times, assuming that you're being very efficient, in other words, using all the correct programs in the correct order and the right prerequisites and so on, then with a fantastic program, you still have to think, okay, this is a 2-year-old, 2-year-olds can't really be doing 30, 40 hours, they get too tired, they fall asleep. 3-year-old, this is the age where research shows we should really be pushing the child as much as possible. Do I count the school hours? I mean, a lot of people ask me that. That, of course, has to do, again, with the quality of intervention in the school and whether it's part of the child's overall ABA program. In the last year of intervention, let's say the 3rd or 4th year, a lot of what you're doing is in school. It has to do with generalizing skills.
Sure.
But not if the child hasn't actually learned a lot of prerequisite skills already, because at that point, then you just want to focus on intervention rather than generalization.
Sure.
So all that sort of stuff comes in, and there is no golden formula. It's just that every study that has been done has shown that obviously if you're doing 10 hours, you're doing less than you're doing a 30-hour program. We did a study a couple of years ago and we showed it didn't even matter. 11 hours is better than 10, 12 is better, 13, 40, 50. The higher you go, the more you're learning, obviously, because it's really good instruction.
Right, that opportunity that we keep talking about, the more opportunities we give a child, the more likely that they're going to succeed.
And so the more impacted the child is, the more affected they are, the more delayed they are, the more hours they should really be getting.
Okay.
I wouldn't really, with a, let's say, child who has Asperger's or PDD, fewer symptoms, older, wouldn't really be doing a 40-hour program because my goals change at a certain point. But with the younger children, yes, you're trying to still get to the point where their mental age will reach their chronological age, which is what we call recovery. And that's where you really want to push the intensity.
So really individualized for the child, for their circumstances, for their age and their abilities, but understanding that 10 hours of ABA is better than no hours of ABA, and it's not 10 hours of ABA doesn't lower your IQ.
It just doesn't get
maybe
your
not
IQ.
Enough to make it go up. And
if you were able to compare, let's say, a 10-hour child with a no intervention child, and they were identical in every way, then over time the one with no intervention would have a bigger drop in IQ points.
Great. Great for us to know. Wonderful. We're here with Dr. Doreen Granpeesheh, truly a visionary in the field of autism. She's answering your questions today live, so please keep them coming in. We had a question that I'm really excited to hear your opinion on, because it's about bullying, and that's a really important subject for a lot of our kids. kids. What's the best way to discuss dealing with bullies, especially when the child is aware that the likelihood of bullying is high at the onset of middle school? This is a really tough time that a lot of our parents are writing in about, and we know we want to front load our kids, but how do we discuss the bullying thing? Help us.
Right. That's another reason that I think it's so important for our kids to be sort of somewhat prepared, at least when they go to school. A lot of times we think that throwing our kids into school when they don't really have the skills to handle these types of things is good for them, because we're hoping for some sort of social interaction for our kids. So we try to put them in school sometimes when I think it's a little bit too early.
Okay.
You know, it's the usual answer. I mean, you do try to teach your child as many of the things that they need in order to identify, first of all, what is bullying. I mean, a lot of times with our kids, they don't, first of all, they might not even recognize bullying and think that, oh, a group of kids want to interact with me, and they won't be able to understand the difference between the other kids making fun of our child versus kind of having fun with our child. And that's a whole series of lessons that we work on. Another aspect of it is our child, once they recognize it, not really knowing how to handle it.
Yeah.
You know, and of course the best scenario is just to walk away from those types of things, tell your parents, have the parents work with the school and try to put a stop to it. Fortunately, there is a really big movement across the United States right now against bullying, not just with our kids, but across the board, and that's wonderful. So a lot of the schools are actually very open to people going in and giving some form of instruction to the classroom and teaching the other kids to, you know, what bullying can be. So and that's very important. A lot of times our kids just come home very upset and disturbed, and they can't even express why they don't want to go back to school and why they don't want to, you know, interact with other kids. And it's so important that with these series of lessons that we have, of course, we teach our kids also the difference between being assertive and being aggressive. If you don't deal with these issues and actually teach the child all the things they need to know, when someone else bullies them, it is quite likely that our child might become aggressive or might become very avoidant or, you know, just take out their anger in some other way. And that's what's really concerning, because for our kids, it's so hard for them to explain how they're feeling to begin with. So, you know, there's a series of lessons like everything else. They're even on skills, actually, where we talk about teaching our children how to identify what other kids are, the inferences.
Right.
Because, you know, a lot of times our kids will just infer the wrong thing. It goes both ways, actually. You know, sometimes our kids will misinterpret something as a bullying act when really it was an accidental type of thing that occurred. So it starts with that, teaching the child to identify scenarios that might be considered bullying, or even just any kind of, you know, mean behavior from another child, and then teaching them the steps of what their options are and how they can deal with it. And again, Shannon, this changes by age, right? I mean, it's one thing if you're in 2nd grade and you go tell the teacher, but if you're in 6th grade, going and telling the teacher might actually make things worse.
Right.
So all of those types of things have to be taught up front. And then as I said, a lot of parents, what they've done, like there was this school district we talked about on a previous show in Arizona, I remember, and the parents actually had put together a program for going in and teaching other children about autism and about how you take in the world and what are your difficulties and what are your strengths and so on. And that really produced a lot of compassion in these classrooms and significantly cut down on bullying and other issues like this.
Absolutely, and you know, it occurs to me that I know Autism Care and Treatment Today is launching Compassion Cares.
That's right.
With ambassadors of kids who are on the spectrum who go and talk about things, and you know, and as that unfolds, we'll let you guys know if you want to have them come to your school.
Yeah, absolutely.
An amazing thing. There's an amazing young man that we've had on the show before, Jesse Saperstein, who is really has a diagnosis and has been out there really speaking about this particular particular issue and makes himself available when possible to go to schools, and how wonderful that is for kids to see a role model, both the child with autism, but the other kids to see as well, and to hear from them that their actions, they're accountable for them.
Yeah, you actually gave me a really good idea. I mean, this would be something amazing for our kids, our older kids who've recovered, if they're interested in starting something like this. Yeah.
Absolutely, because it's important for our kids to see that, and to hear that there are ways that they can deal with it and that their friends can deal with it. So important.
Right.
Great. Another question. Somebody wrote in and said, "Thank you, Dr. Doreen. My son is one of the lucky ones. He is getting ABA and making great strides. My question is about the rest of the family. Why aren't there services for couples going through this and for brothers and sisters? Autism affects us all."
Oh, so true. Oh my gosh. Yeah.
It's a family thing.
It is definitely a family thing, and historically, I mean, I'll have to answer that and say I agree with you. I think there should be. We actually do have sibling support groups here. We have a lot of programs for our siblings. We've actually offered a lot of programs for parents as well. We have MFT counselors who provide family services for our parents. But the truth is, years and years ago, I remember when we didn't have this type of funding that we do now with insurance and various other sources, we offered MFT services to our parents, maybe even like 15 years ago. I remember that. And there was hardly any interest. Yeah. And I think the reason is, and I thought about this over the years, I think when your child is having an issue, you pretty much put all of your resources into your child, and you don't even want help for yourself in some ways. It's kind of like, I don't want to take the time to go heal myself. Most people, I just want to take care of my child and get my child to where they possibly can go. Now that there is insurance funding for most of our kids in most of the states, then I really hope that people start to develop more and more of these programs for the entire family. Siblings in particular, I really worry about siblings because as parents we spend probably 3, 4, 5, sometimes 10 years completely focused on the one child and how to get the child through what they're going through, and we really forget about all the issues that the siblings are having. Well, I mean, I don't want to say we forget, but we just, they're less important. It's less important if you had an argument with your best friend than the other child not being able to communicate. Let's put it that way. But what ends up happening is a lot of our siblings are left out. They're often asked to make compromises for their affected sibling, and that influences their own development. And it may sometimes cause some anger in the siblings that, why did I have to compromise on everything? So it's really important to pay attention to the siblings. And I often say, once we're involved, at least when we have intensive programs, we try to really take care of all the needs of our child. And then I tell the parents, just take time for yourself and take time for the siblings. Yeah,
you guys are really a remarkable model of taking care of the whole family. And
it's
I think
hard.
That well, of course it's hard, but I think that more organizations need to follow your lead. But I would also say, I would encourage people, if you're at the point where you're ready, ask around, ask your local support group what is available for you, because there are more things that are happening. I think the more people are paying attention to your lead, and I so appreciate what you said about parents, because I remember a time when my husband and I were so all in with getting our son help that, to me, I would say, well, the kitchen is on fire. If there's a toilet plugged up someplace else, we're dealing with the kitchen on fire right now. But eventually that toilet overflowing catches up with you.
That's right. That's right. That's right.
And you do need to get help at some point. So, realizing that you're prioritizing, but there are other things that are pressing and important, like your other kids and your relationship with with yourself and your significant other, and
or even your exhaustion level. I mean, sometimes I worry so much for the moms, because I'll do a 2-3 hour. I will never forget. I had a mom who had twin sons and an older son, all affected with autism. And I remember doing a 2 to 3 hour clinic, you know, sort of a meeting with the mom and reviewing the programs and stuff. And after the 3 hours, when I left, I thought I had a headache.
Yeah.
You know, the kids were very, very active and running all over the place and sort of destroying everything, and you had to constantly be on them. And I thought, when I left, my number one priority was to get help for mom.
Yeah.
It wasn't even about what can I do to make these children better right that moment. It was more about how can I save this mom, because I don't know how she's going to manage, like from one minute to the next. And that, of course, you know, there's so much pressure on the parents to get trained and learn everything and 24/7 do ABA with your child and make sure you follow through, And quite honestly, sometimes the parents are just exhausted. And you can't always follow through when you're that tired and you don't have time to breathe.
Yeah.
So even just as important as having a good behaviorist and a good ABA program, I think, is having resources that allow you to have some respite and some time for yourself.
Absolutely, absolutely. You guys did that for me in terms of prioritizing, because, you know, week one when we started, we had our laundry list of things that we were concerned about, and there was some self-injurious behavior that was really tearing me up. But you guys looked at us, and also on our list a little further down was getting him to sleep earlier, because we couldn't get him to sleep before 3 o'clock in the morning. And even then we had to drive him around the block 300 times.
Yeah.
And I had gotten to the point where I expressed that I was afraid I was going to fall asleep driving the car because I was so overtired and overwhelmed. And, you know, so first on my list was the self-injurious behavior. And what got said to me was, we need to take care of the sleep first, because you are going to need to be present to help take care of the self-injurious behavior. And it took a matter of, it's embarrassing, I think it took 4 days before we got him to sleep at like 8:30 in the evening with the help from the Center for Autism and Related Disorders. So it literally was delaying things by 4 days.
Oh my gosh.
But it changed my ability to cope in those 4 days.
Yeah.
It was truly life-changing.
Sleep is a huge issue, Shannon. I mean, our parents just get used to it after a while, and they're walking around like just exhausted, and they don't realize that they haven't had a decent night of sleep in years. And it's just, it shouldn't be that way. And it's usually, unless the child has pretty significant health issues, usually it's a pretty easy procedure. And getting the child to the point where they actually have, you know, 5, 6, 7 hours of straight sleep is unbelievably important.
Oh, yeah, life-changing for the whole family. So those priorities, really important. Okay, all right, here's an interesting one. We just had our IEP, and I really didn't agree with what the school had for goals. I wish I had someone there who knew my kid and what he needed. Does CARD ever go with parents to IEPs? Yeah.
So we always go to IEPs, and we actually are very, very involved with writing the IEPs.
Yeah.
Pretty much, unless the school district doesn't allow us to, we will take over the whole IEP system and write up everything. Some of the school districts in California just don't allow us to write more than a couple of goals, but our IEP reports are massive. I mean, they're basically intended to be very inclusive of everything we're going to do with the child. You know, as a parent, this is one more thing. It's like, okay, not only deal with all the stuff with your child and your own exhaustion and all your other children and all that sort of stuff, but you really need to learn the law.
Yeah.
That is one of the most important things. We have here at CARD a fabulous group of people. Julie Cornack, who's our public policy analyst, and she is just amazing in terms of really reading all the details and explaining everything to us. So it's really important to know you don't actually have to sign agreements with the IEP, and you do have the ability to take the document with you, talk to other advocates, talk to parents, figure out alternatives. There's a lot of accommodations that a lot of our parents don't know they can ask for. There's a lot of things that you can do if you don't agree with the IEP.
Absolutely.
I mean, the law is really clear that the district has to provide to you what is appropriate to your child, for your child. And if you have disagreements with what you consider to be appropriate, then you get professionals involved.
Absolutely.
And in a lot of cases, I mean, that's why, Shannon, we have funding. We had school district funding here in California, because back in the, I guess, early 90s, we didn't. And a lot of parents just went forward and set precedent on this issue and pressed forward and took the districts to court if they had to, and then the districts and we all learned together over time and made the programs so that they do work for the families.
Yeah.
A lot of other states that doesn't happen all that much. I mean, there are some parts of the country where the school districts won't even let someone on the school grounds who's a professional, you know, and the parents, even the parents themselves are limited to 20-minute observations of their own children. Those types of things, you know, you can get help from advocates and lawyers, and it's your right to know what's going on with your child.
Absolutely. And you guys are wonderful at IEPs, and but I recently went through our IEP for the first time without taking card with us. But can I tell you what was so wonderful was that I had skills, and I went through and picked some goals for my son that I thought were important for the playground. And I took because I'd done my assessment for him, and so I knew what was appropriate for him, and picked the ones I wanted. And then the language was there for me. There's the benchmark and the language in the skills program, and so I printed them out, and it was so exciting.
That's awesome. That's terrific.
And those are being added to his IEP, those goals, and they were thrilled with them, and it was a lovely, lovely thing. Love, another thing that I love about skills for that. And I do love skills. Okay. Oh, this is a really interesting one. I have the hardest time explaining autism to friends and relatives. What is a quick way that I can explain it? I was talking about what's your elevator pitch for autism? Wow. Can you get it to a 2-minute thing? I have not figured that out yet. What do you say?
I guess, it really depends on how much time I have. But I mean, I guess the short version for me, my understanding of autism, and you know, I have to say that I don't necessarily agree with everything that's out there. So my way of seeing autism is that it starts with a genetic predisposition, and when I say that, it's really important to define that, because a lot of people think that when we say something is genetic, that means it doesn't change. Well, genetic changes by exposure, actually. So over time, our gene pool changes, obviously. And so when I say it starts with a genetic predisposition, anything that could have been happening with your parents who passed on their genes to you could have modified the genes they're passing on to you. Genes change all the time. They mutate. So you have a genetic predisposition which doesn't lead to autism. For me, it leads to some different functioning of the immune system, let's put it that way. Because I know that with our children, the vast majority of our kids have issues with detoxification. And there's a ton of studies showing that, you know, the kids have high oxidative stress, they're lower than they should be in methylation, so they're actually they're exposed to environmental toxins, and that's a broad list. I mean, there's a million things that are intoxicants in our environment, and we are too. We're exposed to the same intoxicants, but we detoxify faster. And our kids are not detoxifying, and then having those types of toxic elements will then, with the growing, developing brain, will lead to different types of growth and development. So when you see a child who's been exposed to toxic elements very, very early on, you'll see that the child has more sensory type issues, because the first area of development is sensory. And then when you have a child who's been, maybe their immune system is functioning relatively stronger, so they've been able to detoxify, but then at a certain point they overload, let's say post-vaccines or post whatever dietary type stuff that they're not able to eliminate. And then those kids are typically higher functioning, but they have aberrations in other areas of brain functioning. So overall, it's sort of this process where you have the genetic predisposition leading to immune dysfunction, which usually in our kids you'll see in the form of like gastrointestinal problems and digestive issues or detox related issues and so on. That then will lead to different type of brain growth or development. And then the symptoms of the brain growth or development will be what we call autism. autism.
There you go.
Because really autism is just a series of symptoms, right?
Yes.
I mean, nobody really talks about why is my child lining objects up? Why is my child not developing language? And a lot of that just has to do with how the brain develops, right? And if your brain is overexposed to toxic things that it cannot get rid of, it's going to develop quite differently. Your neurotransmitter, your whole biochemistry is going to be different.
Interesting. And so, because a lot of people will talk about environment and say, then why is it just this one subsect of the population? But that
goes
could
back
be
to the fact
genetics.
that they're not. Yeah, I mean, it just goes back to the fact that the vast majority of our kids have problems detoxifying.
Okay.
It's a huge. That's why, you know, when I look at a lot of the medical stuff that's been developing in autism, you know, the basis for all of it is always detox. It's always detoxification. I mean, whether you are giving your child vitamin B injections, whether you are putting the child on some sort of diet, the concept is, let me stop exposing the child to things that are toxic, or things that he or she just cannot digest, cannot make nutrients from.
Right.
And so, which of course, you know, like we talk about diets, gluten, for instance. And, you know, what happens with gluten is if you're not breaking gluten down properly, which a lot of our kids are not, then it starts to, what you're doing is you're exposing, the child is being exposed to peptides of amino acids. And peptides then will, what we call the leaky gut, you know, that's the lay term for it. But essentially what's happening is those peptides from gluten are tricking the child's biochemistry because they act as endorphins.
Right.
And so then our kids are acting as if they're, you know, high on some sort of endorphin. And then, of course, they're not able to focus, pay attention, and so on. So in some ways, that whole, you know, peptide process is also like a toxic thing for the child because it's causing the child to not be able to focus or pay attention. So all of that is kind of like clean up the child's biochemistry, don't expose them to additional toxic elements, and try to stabilize the child's health. That's why I strongly believe in that. And then do ABA, because then you have a awake, healthy child who's sleeping, and you can actually teach them everything they need.
Wonderful information. You know, my running joke always about going to some conferences is that I never need to see another slide of another peptide of gluten or casein ever again, because a lot of, you go and you see, and they start to talk about it, and they put up the slide of the peptide, and you go, okay, I'm going to get a T-shirt with the peptide and say, now we've covered it. I've seen it, but it's important.
Oh yeah, absolutely. But I mean, and not to even, I haven't even touched on the whole concept of, you know, so much of our food is genetically modified.
Yes.
You really aren't receiving any more the healthy bacteria that you need. No one is. I mean, like, it's not limited to our kids. Like, you see so many other people who now have asthma or chronic illnesses, and all you really do is change their diet, and things change for the better.
Yeah, absolutely. And of course, we know that a lot of, I certainly experience as I move about the world and meet other autism moms, that there are a lot of us that have immune issues.
Oh, absolutely.
And that, you know, that was shocking to me when I discovered how many of the different moms that I'm, you know, moving through the world with that also have immune issues. That was just a big eye-opener for me.
Right, but I mean, the interesting thing is, Shannon, if you were to take actual immune testing from everyone across the board, moms or non-moms, it doesn't matter, and you contrasted that to maybe 10, 20 years ago, you'd see a huge difference, because we all do right now. We all do. We all have immune systems that are functioning quite differently than they were 20 years ago. I mean, how many people do you know who do regular juice cleanses? Right? 30 years ago, nobody
knew what that was. That was just some fruity thing that they did in Los Angeles. And now it's a very common thing.
Or even other things like the health of the moms. You talk about how many people do you know who are having a hard time getting pregnant? You know, so those types of issues are beyond autism. We really are, our food source is not very good right now. unfortunately.
Right, and easy to get overwhelmed by those things. We should probably take a break and come back, and then we have one more question that I want to get to today before we go to the story of Luke, but stick with us. We'll be back more with Ask Dr. Doreen after this. Welcome back to Ask Dr. Doreen. Our special guest right now, Dr. Doreen Granpeesheh, truly a visionary in the field of autism. You've been working with
so
children,
nice, Thank
but
you.
it's the truth. I'm speaking the truth. You've been working with children on the autism spectrum for more years than you should admit to, because you look incredibly young and the numbers don't add up.
Now? It would be, we're going into, well, 2012, it'll be 32, 3 years, 33 years.
Well, that's, no one would believe that to
Crazy.
look at you. I want to know what your skincare regimen is. But in any case, that's a long period of time, a lot of changes that you've been right there at the forefront of. Truly a brilliant mind in this field. Such a pleasure for us to have you here and answering questions.
Thank you very much.
We have time for one more question, and it kind of goes hand in hand with what we're about to discuss. Somebody wrote in and said, how can I encourage my teenage Asperger son to transition to college life? What skills should we focus on? And
Oh my gosh.
Yeah, I know. Just a precursor, because we were talking that in a few minutes, when we do Let's Talk Autism with Shannon and Nancy, we have the producer and we have the writer, director, and the star of a film, The Story of Luke, which details a young man as he's going, and he has an autism diagnosis. Although he says in the film, my grandmother says I defy clinical diagnosis. That's what he says. But he clearly has autism, and he is trying to make that transition to being an adult, to having a job, to going on a date, living on his own, and the kinds of preparation he needs and the skills he needs to put in his satchel to do that. So I thought it was particularly poignant with what we're going to talk about. How I want to know, how do we prepare our kids?
It's just too hard to, I guess it's too hard to answer that question in a few minutes, because really you're looking at a massive number of things that have to be taught, and really it depends on the level of functioning of the individual that we're talking about. You know, we say my child with Asperger's, and that because we're kind of contrasting it to autism, I suppose most of us think, okay, well, the child is really, really high functioning and can therefore handle anything that comes his way or so. And that's just not true, because our kids or adults with Asperger's need a lot of help as well. And, you know, it's one thing, you should see our Card 2 curriculum. It's massive, right? I mean, we're, like I've said before, with some of our kids, we're working on just basic communication skills all the way up to how do I dress to go for a job interview? How do I balance a checkbook? I mean, those are just core skills.
Right.
But the truth is, the number one thing that I experienced with my Asperger's adolescence going into college, I guess, is the social aspect being so hard, because they really do, some of our kids have thankfully been protected in a way that they're very happy souls coming into college, and they look at other people as, you know, they project, and they see everyone as being good. And life in college is hard. It's not easy finding the right group to hang out with, and making sure you monitor your own schedule, and at the same time meet the right people. How do I even move to introduce myself to a girl, or you know? And of course, with development of relationships, the biggest thing is trying to figure out how the other person feels, which of course is one of the biggest problems in our area, which is theory of mind or perspective taking. And sometimes other people misunderstand things so fast. You know, it's like, oh, he called me, even with normal adolescence, right? He called me 10 times, he's stalking me, or something like that, right? So a lot of things can go wrong in the college years. And I just think that, you know, I would be doing a disservice to this question in particular if I didn't spend a lot of time on this issue. What I would recommend is, I actually don't know if we even have the, if a parent wants this, I'd be happy to send it to them. It's like a table of contents of all the different areas that we teach our adolescents. It's kind of a curriculum, but it's just the list. Okay. And it's massive, right? I mean, and it really differs for each individual. Again, it has to do with what their skills and deficits are. But again, like anything else, short answer is teach them all the skills you can, protect them as much as you can, because you will want to do a very gradual infusion into the college setting. Make sure that the individual or the child is able to have a certain level of self-esteem based on their own skills.
Right.
Like, this is critical. A lot of my kids who are successful, it's because they have great skills. They're like awesome musicians or awesome whatever, and they go back to that when they feel lonely or when they feel sad or depressed or something like that. So
that's wonderful.
Those are important things, but then I would say that's true for anyone, right?
Yeah, but I don't know that we always think of it in that term, that, making sure that you pack in, here are the things that you're great at that you can always come back to.
Exactly. These are things you can do, healthy ways of dealing with anxiety. I mean, I have a whole lecture on anxiety, or several lectures on anxiety in adolescence with our kids. And it's really all about anxiety. Yeah. Because if you have healthy ways of dealing with anxiety, then you can go through those tough situations in college.
What's always striking to me is that we talk about these things for our kids, like you said, but the truth of the matter is they would be good for all of us.
Oh, yeah, absolutely.
I always say, in particular, the executive functions program and curriculum and skills, that if every junior high school student had the benefit of that, they would be so much more successful in high school and college.
So true.
Forget autism. This would be great. I mean, there are people who pay for business coaches to be taught that as adults.
Exactly.
What's in the executive
how to plan
functions.
and organize yourself. Absolutely.
Yeah.
And also a lot of these types of things, like you mentioned,
anxiety.
like just techniques to help yourself get through tough times. Oh, we do. Some of us do that in a healthy way. Some of us do that in an unhealthy way.
Right.
But we all get through it somehow, and it's just a matter of teaching our kids healthy ways to drop back when they kind of have depression, anxiety, fear, all those types of things which come with college.
Absolutely.
Yeah.
Well, it reminds me that while this journey can be tough, that we get privy to a lot of information that can help us and can help our kids. And a parent that I love and adore, that actually was the first person who said card to me, she said, what's wonderful about this is that I got the best parent training that there is on the planet.
It's so good. That's awesome to hear. I feel that way for my own kids too. But I mean, honestly, we will learn a lot more from our adolescents, which I think I can't wait to go and listen to the next show, because I'm sure that we'll learn a lot from Luke on this issue as well.
Yes, it's an amazing film.
Yeah.
But I thank you so much for being here with us, and we look forward to having you back next week.
Great.
And for those of you, there were a lot of questions that we didn't get to, but I want to remind you that we do keep a list, and we keep putting in some of the ones from previous weeks, so that we will eventually catch up at some point. I can't imagine that we'll get to a point where there are no more questions, but wouldn't that be a thing to strive for when it's all solved and we've answered all the questions? In any case, you can keep those questions coming in and ask for clarification, as somebody did this particular week, if there's something that you want to know more about. And if you're interested in that list that Dr. Granpeesheh was talking about from the Card 2 curriculum, the list of the kinds of things, let us know, and we will make that available to you.